This is spinal molding for hyperlordosis. So the low back is in too much of a curve. So ideally you're in a 45-degree curve for that low back, that arch is right here, but when it's too exaggerated, you're going to put a lot of pressure on those joints. So you want to help to neutralize that out. You don't want to totally take it out. You want some curve, but you want to teach your spine how to unravel some of that curve. And so taking some time to go on a firm surface and laying on the floor, you're going to teach yourself how to neutralize that spine. So again, you want to always add in the cervical roll so that you can support your neck as well. So go ahead and lay down on your neck wedge. Come on back. Put that in the position. So the first thing you're doing is you're finding what's comfortable for you. And so if you have a high arch, that's your hyperlordosis, what you're trying to do is tilt your pelvis so that it's neutral. Most of the time with a hyperlordosis is that pelvis is tilting forward, and so it's causing a lot of tension on that low back. So you're trying to bring the pelvis, the front of your pelvis, back towards the floor. And so as you're doing that, you're lengthening the low back, the lumbar spine. So once you're here, you're also feeling like there's a string that's pulling your belly button down into the ground, and you're holding it there. You can hold that for 10 seconds. And once you're there, then you can relax. And you don't want to exaggerate it, you just want to go back to what's neutral for you. The goal would be that you're doing this on the minute, every minute, at least for the first 5 minutes, and then you're building up to 10 minutes so that you're getting 10 repetitions in. So aim for 5, or aim for 10, but start with 5 and do it so that it's comfortable. So let's try again. So you're gonna bring your pelvis back into the ground, tilting your butt up, the bottom part of your butt up, and then the spine is getting flattened. You're holding that there for 10 seconds, and then you're coming up. When you do that again at the top of the minute, you're tilting your pelvis, bring your belly button into the ground, you're holding that, you're contracting all the muscles around the spine. You're not doing one side or another side, you're just engaging everything. You're still breathing, but you're engaging those muscles, and then you relax, bringing that back. So a count of 10, and you're doing that for a set of 5 and then building up to 10. So have fun with spinal molding.